Assalamu alaikum students. How are you? Today we are going to study the muscle attachments of the radius bone. First, I will show you some pictures so that you can better understand these attachments, and after that I'll show you the muscle attachments on the bone. So this is the radius bone. And this is the head of the radius bone, as you already know. So this head of the radius bone, it articulates with the capitulum of the humerus bone. This is the humerus bone and this is the capitulum. Okay, so this head of the radius, it articulates with the capitulum of the humerus bone to form part of the elbow joint. And this head of the radius, it also articulates with the radial notch of the ulna. This is ulna bone. Later you study this. This is the radial notch of the ulna. Okay, this head of the radius, it articulates with the radial notch of ulna to form part of superior radio-ulnar joint. Okay, this is the lower end of the radius. So this lower end of the radius, it articulates with the ulna to form part of the inferior radio-ulnar joint, and at this lower end of the radius it also articulates with the carpal bones. Later you study them in detail. These are the bones of hand and these form wrist joint with the lower end of the radius. Okay, now we will see some attachments on the radius bone. First, we see this annular ligament. It is attached on the head and neck of the radius. This white colored annular ligament you already see in the picture. It provides stability to the head of the radius and moves the head of the radius during supination and pronation. Okay, now I will show you the some muscle attachments on the radius bone. Here you can see these colored part. Okay, the colored blue part shows the insertion of some muscles, and this red colored shows the origin of muscles. Okay, first we will see this is the upper end of the radius. This is the shaft, and this is the lower end of the radius, and this is the styloid process, which is on the lateral side. Okay, so from the styloid process we know that this is the lateral side of the bone, and this is the medial side of the bone, and this is the anterior view. Okay, so this is the biceps muscle. It is inserted on the rough posterior part of the radial tuberosity. This is the radial tuberosity, and bicep muscle is inserted into the rough posterior part of radial tuberosity, and bursa is present on the interior part of radial tuberosity. So this supinator muscle, it is inserted into the upper part of the lateral surface, and this is the pronator teres, which is inserted into the middle part of the lateral surface, and brachioradialis, it is inserted into the lower part of the lateral surface above the styloid process. Here you can see this is styloid process, and brachioradialis, it is inserted above the styloid process. So this flexor digitorum superficialis, this one, it origins from the anterior oblique line and upper part of anterior border. And this flexor pollicis longus, it originates from the upper two-third of the anterior surface. See, this is the anterior surface, and almost upper two-third of the anterior surface there is origin of flexor pollicis longus muscle. And pronator quadratus, this bluish part, the pronator quadratus, it is inserted into the lower part of the anterior surface and into the triangular area on the medial side of the lower end. And below the radial tuberosity, this is the radial tuberosity, and below the radial tuberosity On the medial side, oblique cord is attached. And this constricted part is the neck, and on the medial side of neck, this is the medial side of the neck, the quadrate ligament is attached. So in this picture, this is the posterior surface, uh, and this is the medial side, and this is the lateral side. So abductor pollicis longus, it is originated from the upper part of the posterior surface, and extensor pollicis brevis, it originates from the lower part of the posterior surface. So these muscle attachments on the radius bone, we can memorize this from the mnemonic SBP SBP. Okay, S supinator, B biceps brachii, P pronator teres, and B brachioradialis, and P pronator quadratus. So all these muscles, they are inserted on the radius bone. So supinator is inserted into the upper part of lateral surface. Biceps brachii on the posterior rough surface of radial tuberosity. Pronator teres into the middle part of lateral surface. Brachioradialis into the lower part of lateral surface above the styloid process, and pronator quadratus into the lower part of anterior surface, and on the medial side on the triangular area, which is on the lower end. Okay, and origin of the muscles from the radius bone is a flexor pollicis longus. Flexor mean it cause flexion of the thumb. Pollicis mean thumbs. Okay, and longus has long tendon. Only at this stage, I just tell you the meanings of this muscle so that you can easily understand it. Flexor pollicis longus and flexor extensor pollicis brevis and abductor pollicis longus and flexor digitorum superficialis. All these muscles, they are originated from the radius bone, and the first three muscles, they are inserted into the thumb, and this muscle flexor digitorum, it is inserted into the digit. Later you study it in the detail. Okay, at this stage you just only want to memorize that these muscles, they are originated from the radius bone. Flexor pollicis longus from the upper two-thirds of the anterior surface. Extensor pollicis brevis from the lower part of the posterior surface, and abductor pollicis longus from the upper part of the posterior surface. And flexor digitorum superficialis from the anterior oblique line and the upper part of anterior border. So this is the interosseous membrane, and the interosseous membrane, it is attached to the lower three-fourths of the interosseous border. This is also called as the interosseous border or the medial border, and this interosseous membrane is attached to the lower three-fourths of the interosseous border. This is the extensor retinaculum, and it is attached to the lower part of the anterior border. Okay, this is the Lister tubercle, which is present on the lower end of the radius on the posterior surface, as you already know. Okay, some tendons pass medial to this Lister tubercle, and some tendons pass lateral to this Lister tubercle. So later I show you, and you have to memorize it. This is very important. Okay, this is the lower end of the radius, and this is this lateral side, as styloid process is laterally, and this is the medial side. And on the posterior surface, this elevation is the Lister's tubercle. So the groove is it is present medial to the Lister tubercle, and tendons of some muscles passes through it. Okay, first medial to the Lister's tubercle, the tendon of extensor pollicis longus passes, and then medial to this there is groove for the tendons of extensor digitorum and extensor indicis. Okay, these muscles later you study them in detail. Okay, now at this stage you have to just memorize there is that medial to the Lister's tubercle, that groove for the tendons of which muscles are present. Okay, these three muscles: extensor pollicis longus, extensor digitorum, and extensor indicis. The groove for the tendons of these all three muscles are present medial to the listus tubercle. Okay, so this is the lower end of the radius, and this is the listus tubercle, and lateral to this listus tubercle, the groove is present from where the tendon of the extensor carpi radialis brevis passes, and then lateral to this is the tendon of the extensor carpi radialis longus passes. Okay, at this stage, later you don't get panic. At later you study it in detail. At this stage, just memorize it that there is groove present medial and lateral to the listus tubercle, and some tendons of the muscles passes lateral and medial. Just memorize the names. Okay. So this is the inferior articular surface of the radius bone, and this area. Okay, first we will see this is the stylar process, and this is the posterior side. Okay, this here you see the listus tubercle, and this is the medial side, and this ulnar notch is present. Okay, this is the ulnar notch, and this is the inferior articular surface. And this articular surface, it articulates with the scaphoid bone, and this it articulates with the lunate bone. Later you study them in detail that these are the carpal bones. Okay, and this is the ulnar notch. So this is the ulnar notch, and the articular disc of the inferior radio-ulnar joint is attached to the lower border of the ulnar notch. So this is the lower border of the ulnar notch, and the articular disc of inferior radio-ulnar joint is attached here. So this is the inferior articular surface, and the articular capsule of the wrist joint is attached to the anterior and posterior margins of the inferior articular surface. So this is the posterior margin. So this is the listus tubercle, and this is the posterior side, and this is the posterior margins. So articular capsule of the wrist joint is attached to the posterior margins of the inferior articular surface, and this is the anterior margin, and it is also attached on the interior margin. Okay, this is very important in the prof and in the viva. The examiner asks you about that show this capsular attachment of the wrist joint on the lower end of the radius. Okay, so you have to also draw it, okay, with the marker. So memorize it that this is attached on the posterior and the interior margins of the inferior articular surface. Okay, this is very important. So this shaft of the radius bone, it ossifies from the primary center, which appears during the 8th week of development, and the lower end ossifies from the secondary center, which appears in the first year and fuses in the 20th year. And this upper end of the radius bone, it ossifies from the secondary center, which appears during the 4th year and fuses in the 18th year.